Okay, so those are the 21 steps just as a background of information. So how do we measure improvement with ADHD? Really, it's important if you've gone for assessment of ADHD or you're involved in assessing ADHD, you know we use checklists. And that's a very important part of it. So it's important to do questionnaires in the beginning, and it's important to do questionnaires for follow-up and monitoring. And if you're working with a doctor who doesn't automatically say, well, it's been 2 or 3 months on this dose of medicine, let's do some checklists, go ahead, find some online, print them off, and give them to the teachers and take them in yourself and get them reviewed. In kids and teens, you can use the SNAP-4, SNAP-IV, the SNAP-4. It's free. You can find it online and print it off. For adults, you can use the ASRS, and that's a free questionnaire as well. So you want to be doing the pre and post monitoring. And there are times in my office where the mom comes in and says, things are great. They're really good. Things are really improving significantly. And the teenager says, I'm feeling much better. Things are working great. And then I get the questionnaire from the teacher that shows some improvement, but not quite enough. And I show it to the teen and the parent and say, look, teacher says you are improved. Like if we compare it to 2 months ago, there is some improvement, though there's still some issues here. And they say, oh yeah, we can see that. And I say, well, let's just adjust the dose. Let's just do some minor adjusting to make sure you get the full response. And that's the difference in treatment that doing these follow-ups can make. It's important to look for other realms of assessment and monitoring. If we could get every doctor who treats ADHD just to do the ADHD symptom checklist pre and post, we'd be improving the quality of care dramatically. Now if we can add some measures of executive functioning, quality of life, and impairment, we can take ADHD treatment to a whole new level. Executive functioning you've been hearing about all morning. Quality of life is really looking at the nature of one's functioning and sense of well-being across their life in multiple domains. And there's starting to be some research in quality of life. I'm sure the people in this room won't be surprised to hear that when the quality of life measures are done in research to compare ADHD individuals versus kids with chronic medical conditions, ADHD individuals have a lot worse quality of life in multiple realms, except for sometimes the physical issues for the people who've got the chronic medical issues. But insofar as the emotional impact, psychological impact on the parents, insofar as their time, impact of the parents insofar as their emotions, dramatically more impacted in ADHD than in the medical conditions. And if we look at impairment as well. So these are the types of things that hopefully our field is moving towards in the near future. Now, if we look at the role of medication treatment in ADHD, this is a summary slide of the Multi-Modal Treatment study. This is one of the best designed studies done in ADHD that compared rigorous medication treatment, which it was done in the 90s, so this was Ritalin 3 times a day. So rigorous Ritalin 3 times a day on a dosing protocol versus psychosocial treatment only. This is behavioral treatment, sort of an ADHD behavioral summer camp, and then several hours a week, like we're talking 10, 15 or more, after the camp with an ADHD therapist working with the family in the school. Far more than we get in this community from our agencies. And then they had a combined group. And essentially what you can see here is the psychosocial only group had about 34% of people who were classified as a clinical success. The medication only group, 56%, and the combined group, 68%. Statistically, there was a difference between the medication group and the no medication group. So medication significantly improved the symptom control compared to no medication. Now you'll see there's a trend toward improvement in the combined group versus the medication group, but when they did this full statistical analysis, they were not statistically different. So some of the people who weren't so enthusiastic about psychosocial treatment said, well, let's just give medicine then. We don't even need all those therapies. Medicine's cheaper. We don't have, waiting lists, and well, there still are waiting lists, but we don't have as many waiting lists, and we don't need as many therapists. But if you actually drill down and look at it, the people who were in the combined treatment, they were much more committed to their treatment. They often used lower doses, and they often did better in some of the secondary measures, things like oppositional behavior, emotional distress, family functioning. So really, where it's at for ADHD treatment is combination treatment or multimodal treatment. And medication has been shown to actually be a significant part of that. So multimodal treatment, we've got psychoeducation, just learning about it. And this happens so much with adults with ADHD. Just knowing that this is ADHD and that's the explanation for what's been going on can be tremendously therapeutic and helpful. Treating comorbid conditions, being aware of the depression, anxiety, learning disorders, etc. Therapy, things like parent management training for parents, individual therapy, family therapy, or social skills training, academic strategies in school that'll work, ADHD medication, stimulants and non-stimulants, appropriate physical and special interest activities, and coaching as well. Now, I got to tell you, I'm showing a lot of inhibition right now to not talk for 10 minutes about this slide, but we got to stick to the medication. So I'm exerting my inhibitory control for my executive functioning because I've got a lot of great little anecdotes about each little point on this slide, but let's stick to medicine and make sure we've got some time for Q&A. So ideally, we have multimodal treatment, though oftentimes it's prescription only. Hopefully it's prescription after a very thorough assessment, though sometimes I do hear stories of people who go to the doctor and 5 minutes later walk out with a prescription for medicine. We aim for a comprehensive treatment and assessment, and you need to get educated because oftentimes you are the people who go back and educate your doctor. And I apologize for that. It really shouldn't be that way. It seems absolutely absurd, if a woman had breast cancer or a man had prostate cancer, to have to go to the doctor and explain what this condition is, make sure they know it's real, say these are the medications I want, and they really do help, and you should actually prescribe them at the doses I need, and you shouldn't try to tell me I'm going to misuse the medicines and try and sell them on the street or something, et cetera, et cetera. So it really shouldn't be that way. I apologize for that. I spend a lot of time educating physicians as well, and hopefully with time this will improve.